Hello everyone, and welcome to this audio podcast as part of the Bostix Titus issue. This audio podcast as part of an analytical storm and a giant storm. Welcome to this audio podcast as part of another Storm Robotics production. In this overview, there will be some context in regard to telehealth, in context of telehealth and telemedicine, and to begin with, a little bit of some underpinning. So it has been almost 2 decades, since the UK government, for example, published a document, for example, the expert patient, a new approach to looking at disease management. Looking at the chronic disease management in context of the 21st century, or for the 21st century. The UK government at the time, had published this document, and the attention at the time was that service users would lead others by example, being experts. And although the initiative was published in the United Kingdom, originally in Australia, examples from the document that was published had been implemented implemented in some bases, as aligned to, for example, what would be important as good quality information for service users and patient care. And there was an issue around the provision of appropriately and culturally aware information, and knowing who, for example, to contact for aspects of in around different aspects of disease. And this was especially important in remote communities with limited access to healthcare, and the inclusion of patients or service users was not reported in literature retrospectively. So patients again seek out information through online and through patient-based organizations, which are one of the most promising aspects in around tech, and the use of health information and around peer support groups, for example, or in this context, social media platforms, for example, increases patients' general understanding of topics through sharing lived experiences, and prompts self-empowerment, increases confidence, self-esteem, and reduces aspects in around, for example, anxieties. So eHealth meets some challenges, such as bridging support for those in sort of low socioeconomic socioeconomic sort of sort of pop in low socioeconomic sort of populations, but at the same time at the same time whilst there can be some advantage in this in the spaces, otherwise can also act as a potential hindrance or barrier. The increased awareness and use of e-health services are associated uh, uh, with higher levels of literacy and educational attainment, at least in context of some of the literature, or some of the clinical or medical literature, that has been sort of published. Um, there had been one particular Scandinavian investigation that looked at cancer, a form of cancer in females, and highlights that significant internet use as a source of information on health and illness. And the investigators indicated that language can be a barrier, since the default online language is English. Is in English, and the number of medical websites written in English is thus greater than in any than in other languages, and can be either advantageous or disadvantageous, depending on who is seeking out information and context. So, in line to sort of telehealth and telemedicine, so health and self-management by adults with particular long-term conditions and use of tech, for example, telehealth and telemedical devices, um, e- um, uh, can be advantageous. Equally, there have been concerns relating to children and young people with children and young people with illnesses. Um, the involvement of children and young people in around self management is, however, meeting a specific need, but privacy or trustworthiness and validity of information and accessibility are still ongoing issues, at least in context of those who suffer with particular conditions in the pediatrics and young people's in pediatric and young people's populations. So, greater internet use at the same time in elderly individuals has also been observed. One investigation highlights internet use by elderly has helped decrease, for example, aspects of loneliness. The interest through home telecare systems has progressed rapidly, sort of post early 2000, and telemedicine is usually described as home telehealth, tele home care, or home based e-health. So the aim of telehealth ultimately is to increase a patient's independence and quality of life, and where a basis also is can be advantageous for organizations and authorities, but it can also prompt collaborative and team working between healthcare sectors and healthcare professionals. So patients and peers can use patients and peers sort of using online online and communities to retrieve information on emotional and instrumental support support for understanding across several across different sort of diseases. And online health communities, for example, blogs, online support groups can be a good sort of underpinning in around peer support. The storytelling about the illness of patients is helping or has helped enhance aspects of a well-being and around well-being according to some literature, and it could breach it could at the same time sort of breach sort of aspects around isolation and lead to the articulation and transformation of individual experiences in around particular illnesses. So thank you for tuning in on this audio podcast as part of the Bostix Titus issue, as part of this audio podcast as part of an analytical storm, and this audio podcast as part of the Giant Storm, and this audio podcast as part of another Storm Robotics production.